Was the practices and living conditions of mental patients in the Victorian age ethical? Although some believe the mentally ill wouldn't appreciate hospitality, the treatments and living quarters associated with mental asylums in the Victorian age are unethical because of the unsanitary conditions and inhumane practices.
Men were seen as superior to women, and the treatment they received in mental asylums reflected that because of the poor care that doctors provided. A majority of the individuals who were admitted into mental asylums due to their illnesses consisted of women. Abortion was frowned upon at this time by society, so when women were raped and impregnated, they had no other sensible option than keeping and raising the child. Because this baby was not conceived through marriage, women were seen as insane and institutionalized. The male wards were tightly ran with strict rules, but male patients were understood to be more mentally stable because it was believed they had a larger capacity for intelligence. Men were checked into asylums for reasons ranging from PTSD-like symptoms to suicidal feelings. Even though some of the male patients were not legitimately crazy, they were seen as a nuisance to society and were incarcerated for uncontrollable behavior. Because doctors had little to no medical training and lacked sufficient skill level to properly care for individuals in the ward, the treatment was of poor quality and they partook in many unethical practices. Not only were these treatments unjust, they also served no purpose in furthering the curing process of each individual.
The reign of Queen Victoria caused a movement in the innovation of social, cultural, and economic change throughout the Victorian era, which in turn affected the many mental asylums. Because of the epidemics during the Victorian era, Chadwick created a report on the sanitary conditions of the cities and how they can be improved or altered. Because of the epidemics breaking out in the towns, many went insane and were then admitted to mental wards to hopefully cure their troubled mind and become normal once again. Throughout the time, many advances in technology led to create new medical practices within the era. With this knowledge of new medication, the wards would become less impacted because they would find treatments for those who were not as mentally unstable as the completely insane. As for the economic advancements during the Victorian age, a shift in income caused a rise in the Victorian middle class. Although the workers did most of the hard labor under harsh conditions and long hours, the aristocracy reaped most of the benefits in result of the working class.
Since the beginning of the Victorian age, psychiatric facilities provided care when other better alternatives were lacking. In 1847, the Earlswood Asylum was founded as a child's institute that was intended to educate idiotic and mental patients with domestic and vocational skills. The actions taken by parents that were supposed to treat their child's mental disabilities were completely unethical. Instead of supporting the youth, they took advantage of the mental asylum system. One of the first Victorian asylums to be built in response to the 1808 County Asylums Act was the Stanley Royd Asylum, which consisted of strictly men. Because of the inhumane practice of allowing normal people to be held in confinement, many of the asylums during this era were heavily impacted, therefore making the conditions uncomfortable and harsh. Due to the fact that asylums were overcrowded and understaffed, these mental hospitals violated many health code regulations. Patients were taken advantage of by the authority figures at the asylums and often beaten and experimented on by doctors.
Once admitted, patients were sectioned according to the severity of their illness, and those who were relatively collected were treated better than those who were unpredictable. Wards were designed to aid different levels of illness, ranging from completely normal to severely mental. Each ward contained an arched alcove in which patients could participate in indoor activities with others, which widened their social skills. This act of kindness was only offered to privileged patients. For the sake of the visitors' protection, seriously ill patients were contained furthest away from the main entrance. The decision to keep them away from the majority is justifiable because they are posed as a threat to others occupying the asylum. Considering the quieter patients were more considerate and respectful of the visitors and administration, they were granted more rights within the ward. The quieter, more stable patients were given more rights because it was thought that their mental capacity was larger than those who suffered from severe mental illnesses.
The unethical treatments of patients was, in a large part, due to the lack of knowledge and technology needed to properly care for the mentally ill. Because the Victorian age was not advanced in medical technology, many toxic drugs were believed to be ethical treatments and a curable resource used on patients. Rather than treating patients in order to further their mental capacity, doctors and nurses would drug the ill occupants for temporary relief. Malpractices ranged from simple therapy to complex procedures, which we would later find out actually harmed the patient rather than curing them. Patients were intimidated into obeying authority figures because they had complete control over various punishments that could be administered in result of a wrongdoing. After inspection of many mental asylums built during this era, the general public became aware of the unsanitary and inhumane conditions which many people were forced to live under. Astonishingly enough, doctors who were thought highly of partook in disturbing behaviors in which they refused to better.
Even though many believe that the mental capacity of the ill would not warrant hospitality, there is no justification for the unethical living conditions. Patients with a mental setback received little to no care and compassion from those who were supposedly in charge of curing their disabilities. Overcrowding as well as minimal upkeep to the building only furthered the damage already caused by being placed in a mental asylum. Treatments ranging from therapy to lobotomies were frequently misused throughout the years in asylums, creating a false hope in curing people's loved ones. In no way was the practices and living conditions during the Victorian age ethical. The patients deserved better care and devotion from doctors to successfully heal them.